When a patient is diagnosed as pulmonary tuberculosis, we put the patient on anti-tubercular treatment, usually DOTS, directly of therapy short course. And if he is a new patient, he has to take the treatment for 6 months. If he is a relapsed patient, then he has to take the treatment for 8 months. He has to come to doctor for follow-up every 2 months, and whenever he comes for follow-up, we do some investigation, mainly sputum smear for AFP or Mycobacterium tuberculosis, to see whether the patient is improving or not. And besides this, we do some other investigation. If we suspect some other problems in the body, then we do liver function test or hemoglobin or some other test also. And sometime what happens during the treatment, patient develops some complication due to the treatment itself, or sometime due to the disease itself. We cannot avoid the complication due to disease, but we can avoid the complication because of treatment itself. And to avoid those complications and avoid those problems, those issues, we have to consider a few things. We have to address some issues before the treatment is started. So friends, today I'll tell you 9 such points, or you can say some issues, those you must consider and you must address those issues before the treatment is started. Then for you it will be easy to follow up the patient, and for patient also it will be very easy to take the treatment and to be like in confidence that okay, my treatment is going right and I'm improving, and we can avoid unnecessary complication with the treatment. So friends, I'll start the points. Hello friends, today I'll discuss a few points regarding pulmonary tuberculosis. Those points you must consider before starting the treatment of a patient. So first one is, we have to take proper history of the patient, whether the patient had ATT or anti-tubercular treatment in the past in his life. This is very important to know whether the patient had anti-tubercular treatment in the past, or he had pulmonary tuberculosis or any type of tuberculosis in the body in the past. Why this is important? Now I'll tell you. If the patient had tuberculosis in the past, either pulmonary tuberculosis or extrapulmonary tuberculosis, and he had anti-tubercular treatment in the past, then again we have to start anti-tubercular treatment, but not the same course or not the same doses. So we have to adjust the thing, we have to change somewhat the treatment pattern, and we have to start sometime new treatment. So to know the history of anti-tubercular treatment in the past, it's very important. This is one thing. Second thing is, if the patient had anti-tubercular treatment in the past, why he was not improved, or whether he was improved or not, whether he was cured or not. If he was cured, then why he has developed this pulmonary tuberculosis again, that is also important. So it will give us a clue why this patient is developing pulmonary tuberculosis again and again. What is the problem, whether the problem lies inside the patient or whether our treatment is not in the correct direction. So we have to ask the patient whether you had ATT, you had completed the treatment, whether you were given 6 months treatment, or whether you were given 8 months treatment, how many months you have taken the medicine. Sometimes some patients take treatment after a few months, when he is improved a little, then he leaves the treatment. So in that case, we have to take the history properly, whether he has taken the full treatment. If he had taken the full treatment, then whether he was declared cured. So this declared cured is done by doctor. After the treatment is completed, the patient has to go for follow-up, and we do some investigation, and doctor usually give the certificate, I declare the patient as cured. Okay, now the second point. Second point is whether the patient has any addiction, whether he is a smoker or alcoholic or taking some other drugs, whether it is IV drugs or oral drugs. If patient is a smoker, then how many months or how many years he is smoking and how many cigarettes per day. That is important. Cigarettes, bidi or cigar or any type of smoke, that is important, because if the patient is a smoker, then the possibility of having a background of lung disease, maybe chronic bronchitis or COPD, is there. So on the background of this type of chronic disease, that patient is having pulmonary tuberculosis, so we can explain the patient and patient's family member that patient will be in problem, like there will be probably breathing difficulty, and because he is already having a disease, and on the background of this he is having pulmonary tuberculosis, so we can counsel the patient, family member and patient, and we can explain them that on the background of chronic disease he is having pulmonary tuberculosis, so he will be having breathing difficulty, chest pain and lots of other complaints, and he should be strict to the treatment. Otherwise he will be having lots of complication and sequelae in later life. So we have to explain the patient and patient party. Next is alcohol, whether the patient is taking alcohol. If he is a chronic alcoholic, then the possibility of having a background of liver disease is there. So we have to ask the patient again that if you are alcoholic, then how many years you are taking or how many pegs a day, and whether you are already declared any liver problem or any type of liver disease, whether fatty liver or NASH or any other type of liver disease, whether the patient is having. We have to ask the patient. So background of this history of alcohol is important. And another important thing I have faced, that many alcoholic patient, you can say most of the alcoholic patient, they don't stick to the treatment because they are so much addicted to the alcohol that every day they go for drink and they don't take the medicine properly. And another thing is because of the alcohol intake, sometimes their liver is damaged and the liver cannot properly metabolize the drugs we give. So a patient complains that I'm not able to take the medicine because I'm having problem and I don't feel comfortable taking those medicine, but he feels more comfortable taking alcohol, so he doesn't stick to that treatment. And this is a big problem in case of antitubercular treatment. If the patient doesn't stick to the treatment, then possibility of cure is less, and patient might develop multi-drug resistant tuberculosis and he might relapse again. So I've seen many chronic tuberculosis patient, they are not at all cured because they don't stick to treatment. Whether you give as a new patient or you give a treatment as relapsed patient, they are just not cured. And ultimately the mortality is high, patient dies. So that is one factor. So the next thing is drug addiction. Any type of drug addiction, whether it is IV drug addiction or oral drug addiction, canny, tobacco, betel nut, these things are bad for health. And if the patient is having pulmonary tuberculosis, so already he is having a disease, he has to take lots of medicine, he has to take proper nutrition. Then if he takes drug, then the possibility of cure will be less. So we have to explain the patient and patient family member that he has to stick to the medicine, he has to leave all those bad habits. Next point is liver function test. Though routinely we don't do this liver function test, but any patient with chronic alcohol intake or fatty liver or NASH, we have to do this liver function test so that we can at least judge that what is the normal liver function of this patient, so that we can adjust the dose of the medicines, because almost all the medicines are metabolized in liver, and if the patient is having some liver problem, then these drugs will not be metabolized properly. Next point is liver function test. Though routinely we don't do this liver function test, but if the patient is a chronic alcoholic or having fatty liver or NASH, then we have to do the liver function test to know the basic liver function of this patient, so that whenever the patient comes for follow-up, we can judge the condition of the patient. And sometime patient comes with jaundice or drug-induced hepatitis in follow-up. That time we can compare the basic liver function and the liver function in the follow-up, so that we can understand the thing whether the condition is because of drug or whether the patient already had some liver problem. So this is the reason we do liver function test. And in case of multi-drug resistant tuberculosis, liver function test is must, because multi-drug resistant tuberculosis treatment is a little more, you can say, more aggressive, and those drugs are more aggressive. In that case, we should know the basic liver function. Next is kidney function. Kidney function we also don't do routinely, but if any patient complains of any history of chronic kidney disease, history of any decreased urine output, or any problem with kidney, then we can have a basic kidney function, urea and creatinine, so that later on when patient comes for follow-up, we can compare the. Next point is weight of the patient. This is a very simple thing, just a simple measurement. Patient can have this measurement at home or any nearby health sub-center, and the condition of the patient can be judged, because as you all know, tuberculosis is a disease where patient will have loss of appetite and loss of weight. So if the patient is taking treatment, then we can follow up the patient with the measurement of weight. Before starting of the treatment, we will take the measurement, and again when patient will come for follow-up, we will take the weight, and we can see whether the patient is improving or not. And this simple measurement patient himself can do at home. This is not a big thing. So this simple measurement can give us idea about the improvement of the patient. Next point is diabetes mellitus or high blood sugar. In general term, we call as high blood sugar. If the patient is having diabetes mellitus or high blood sugar, then the chances of not getting cured of this patient is high. So we will ask the patient and patient family member whether this patient is having any background of high blood sugar or glucose intolerance, so that in the beginning itself we can put on insulin, or we can put on treatment so that the patient's blood sugar is gets down. Because if the blood sugar is high, patient will not be cured at all. If the blood sugar is high, any type of antitubercular treatment we give, patient will not be cured. So the blood sugar, to get it down, is very necessary. Oral hypoglycemic drugs doesn't do that much good, so insulin is must, and the patient should be having some strict diet chart so that he can be cured from pulmonary tuberculosis. Next point is immunosuppressive diseases. There are lots of conditions where patient's immunity is suppressed, and because of this, patient doesn't respond to any type of treatment for pulmonary tuberculosis. These conditions like HIV infection or AIDS, like leukemia or blood cancer, you all know, chronic kidney disease, chronic liver disease. This type of immunosuppressive diseases, conditions where patient's immunity is low, any type of treatment you give, patient is not responding, then we go for searching this why patient is not responding, and we find out that patient is having this type of immunosuppressive condition. So it's better to ask for history, it's better to do the investigation before starting the treatment, so that doctor at least has an idea that why this patient is not improving, or what type of treatment adjustment we should do. Whether if the patient is having HIV infection, then we have to judge the situation, whether the patient will be put on antitubercular treatment first or whether the patient will be putting on antiretroviral therapy first. So for all these like adjustment of treatment, we have to take the history before the treatment is started. Then another two diseases I'll tell, you have to take the history. That one is bleeding disorder or any hypersensitivity to any drug. If patient is allergic to any drug or hypersensitive to any drug, then we have to restrict them. So the next point is history of treatment, whether the patient is put on any type of treatment for any disease like epilepsy or any cancer, because anti-epileptic drugs or some cancer chemotherapy or some other medicines also, they are having drug interaction with antitubercular treatment. In that case, the effect of antitubercular treatment will be less and patient will not be cured. So we have to take the history of treatment. And the last point is pregnancy. If the patient is a female patient, we must take the history of last menstrual period or patient is pregnant or not, because there are medicines which are harmful to the fetus or to the mother if the patient is pregnant, and accordingly we have to adjust the dose. So these are few points you must consider. You must address those issues before the treatment is started. Friends, that's all for today. Thank you for watching this video and stay healthy.